just to get started, like we're saying, this is for the Re-Educated podcast. So essentially, the podcast is a podcast that addresses inequities that are going on specifically for the Black community in New Mexico. And so we do various topics from talking about education to law enforcement to different pieces of legislation that go on in New Mexico that affect the Black community. And so one of the big topics, which is this topic, is talking about vaccinations and vaccines and just how that plays into the Black community's relationship to medical care and healthcare and their relationship to healthcare professionals. And so again, I'm Devin Williams. I'm with the State Office of African American Affairs. We also have Danny Golden, who is used to be on the radio show, used to be a host, and she's currently the host of the podcast. And before we get started, if you can, Dr. Fuller, give us a little bit of an introduction about yourself.
For sure. My name's Felicia Fuller. I work for the American Lung Association. I am the director of lung health here in the Chicago office. So basically in charge of everything and all lung health for the state of Illinois. Of course, Chicago is the biggest city, so a lot of our time, or my time, sits here. Working for a national organization, I'm called to do things that are relevant to other states because a lot of me's aren't all over the country. So I'm definitely happy that Danny and Devanya, you both, invited me to come to speak. I've been with the organization about 8 years. Before that, I was with other nonprofits. So I call myself a nonprofit girl out there trying to save the world and a bit at a time. And I have my doctorate in public health. I came up a lot in the age of HIV. So a lot of my research a long time ago was around HIV, and went to University of California, University of Pittsburgh, and then University of South Carolina. So I've been around and I think I know a lot about public health, and then I try to be specific about lung health and health disparities, urban health, but also rural health. Getting my doctorate in South Carolina, I know a little bit about rural health and health disparities as well.
Yeah, definitely. And thank you for the introduction. While we're talking about your profession and specifically lung health, can you talk a little bit about what it's been like or COVID-19's effect on individuals' lungs, and has there been any additional research on that?
You know, it's new, Duan. It's such a new topic, and we're constantly doing, there's constantly research and evidence being produced. So, for us in public health, our minds are spinning. And so I do be on another panel in North Carolina, and they was like, do you have slides? No, actually I don't, because things are changing so constantly. So I study what I do, and which I definitely, anybody can do this, is I study CDC's website. I study my state health department's website as it applies to COVID-19. I study FDA. I get up and watch boring Sunday morning news with Dr. Fauci. Those are things that I do to kind of keep up. Anything new, we know this virus is, I won't even say probably, it was not addressed appropriately in this country. And there's a number of scientists that say that. I would say half the people that have passed away did not have it. This is a preventable disease. We kind of were caught back on our heels, unfortunately. So now that we're here, we know what we need to do. I think we are in a better place with a vaccine. It's rolling out wonderfully well. However, there are some challenges and barriers as it comes to the Black community. And as many have seen during this last year, we see how the disparities in how COVID has affected the African American and Black community. 3 more times likely to die. We tend to have secondary conditions that lend itself to this awful disease. Number one being, I believe, obesity, diabetes, heart disease. All of these things are what they call cofactors or secondary factors that if you do come in contact with COVID, then you will have probably more than likely severe outcomes, possibly severe outcomes, hospitalizations, and unfortunately death. And that's what we have seen since many African Americans have those kind of health disparities. We have seen that. So in order to fight that, we have to be vaccinated. So
definitely. And I think that a lot of people view it, as a game changer. We've been talking about it because we were in kind of this bubble for so long of, quarantine from last year, 2020, fast forward to now. We just heard so much talk about it, but now we're rolling it out. And I think what is the most, because I think there's a lot of talk around controversy, I should say. Not, that's a better word than talk. What are like some of the biggest myths that are being perpetuated at this point, or maybe one or two?
Yeah, some big ones. I try to keep out of rabbit holes. Like I said, I try, and I suggest everybody really go to websites and places that you can get reliable, evidence-based material and education. It's easily to go down what they call rabbit holes, get on social media and see. My sister in California, she'll send me 2 random doctors that were getting together and saying that, this just hasn't been tested enough. I think we get that it was done so quickly. People are dying, but they're really not telling us they're dying. And those are kind of things that I've heard. You guys may have heard some other things. You might get wishy-headed or kind of mushy-headed. Those are things that I have heard with the vaccine. I just don't think our government would hide thousands and thousands of people are dying. That's not something that we can possibly hide. We're making a big deal out of 6 people out of getting the J&J vaccine out of 7 million, and 6 women that had blood clots. And in any normal world, if 6 people out of 7 million had a problem, that would not ever make the news. Okay, right. We are being very, very careful, very, very careful in really documenting any issues. The Biden administration has put billions of dollars into now trying to find extra variants, documenting them, how we address those. So again, those are some of the conspiracies or other things that I've heard, but you just don't hide death. You don't hide people's whoopee minds. You don't hide, those are just things that you have to stay away from.
And one of those ways that you were saying, before is just doing your research and utilizing credible sources. That's something that you yourself as a medical professional, back to yourself, you say, this is ever changing. There's new information available constantly. So, just arming yourself with the information can do wonders in, just keeping that clear path. And
for sure.
Yeah,
for sure.
I know.
And you have to understand that the drug companies, they're saying the scientists, or the government's out to get us. Well, the government didn't come up with these vaccines. Corporate America, pharmaceutical companies did. And there's nothing in this. If they put out a vaccine that did harm to people, they lose money. This is America. Everyone's trying to make money. So in essence, that's a backlash. They're trying to do everything they can to continue making money, not to have suits and have bad press. So
we're in a place too, in talking about as this vaccine develops and people kind of, information peels back those layers and we move forward, into, getting folks vaccinated. The main concern, I think, for most people is just getting things open and getting, in the safest way possible. And so in your opinion, the vaccine is a really key point in doing that.
For sure. The vaccine, and I'll probably mention our toolkits. We have a wonderful toolkit that's geared towards the African American and Black community that answers a lot of interesting and some of these questions. But vaccination, if we could get 70 to 80% of us vaccinated, we will get what we call herd immunity. And that means that you kind of walk outside, and if you were in contact, it would just bounce in layman's terms, the virus would just bounce off, or you would, of course, get it, but you would have no symptoms, just like the flu shot. And so it wouldn't have a body or a host to replicate in, to mutate, get stronger, find another person to get in and do those same things. So yes, it is definitely an answer, or a part of the answer to beginning to live life how we want. You can look at different countries that have done a great job. I don't know, fully conquering it, but you look at New Zealand, you look at Australia, and they have somewhat diverse populations, but they've been able to, really tamp it down, that they had full buy-in with masks, 6 feet, staying in your house. I don't know what the word freedom means anymore. Really conquering it, so that now you see pictures of them going to the bars, partying, and like
not wearing no masks.
Yes. How does that happen? No mask, partying, and if they get 2 or 3 people that got it, hey, those people are real quarantines.
Real quarantine.
The real quarantines, not what we, I still go out and take a run. I might have my mask, on real quarantines, and so that the rest of the country stays safe. And
that's something that we forget, is that like we came in, this new age of like this pandemic, which none of us have experienced in our lifetime. The word quarantine, it was not what we like see it, you know what I mean?
Yeah, we kind of made it up as we go. I'm still gonna go to the store, I'm still gonna do this. And
real quarantine, medically, you're literally in a confined area. You have no contact with anyone.
Danny, correct.
So we have experience. I think it's important for us to put that into perspective in some ways, although it has been difficult, and we have every right to feel this fatigue and this loneliness, right? But we didn't go through like some of us did because of the disease, but the vast majority of us are just having to stay home. But that in and of itself, poses its own issues.
For sure. And and it's many people say here in Chicago, it's the Latino population that kept let us stay home. Sure, the Latino and the Black community. Or workers that don't do the jobs us three do. We're sitting at home doing, typing on our keyboards. They are delivering groceries, other or whatever. It kept us going, and that has to be respected and applauded. But the past administration did not deal with this the way I learned in Public Health 101 back in school, and how you deal with, and you never politicize anything that a pandemic or a virus or the flu or any disease. They're not politicized. So I think if we all had came out with masks, social distancing, and really thought that what we had around his town, we're all in this together. If we really had, all of us had got that, I think that we could have saved some lives and saved some pain and some hurt and some money, and maybe been closer to being out of this by now. So
yeah, definitely. And just to kind of go back to the quarantine, what was like the reasoning behind the 14 days? Just because when the initial virus came out on the news, and then the first people in America came in quarantine for 14 days, and then they're like, oh, they're good. I was like, I don't know, this is something
you
new.
Didn't know if they were good in 14 days.
Yeah, I'm like, why 14? Like, we don't even know what this is. And so
well, they looked at research the Chinese have been in some ways very hidden and reserved, but in some ways they were open to talking about what was happening in China far before it got so Europe, we follow Italy and England, and their scientists and our early scientists got on board and just thought, okay, it looks like this virus can live 14 days. And I think we always go a little bit farther out, because now it has been reduced to 10 days. So what happens is, if you're exposed, the virus can start giving you symptoms within pretty much 3 to 5 days, you'll get sick. And some, 40% of us, are healthy, we're fine. We won't have any symptom, but we're passing it on. So you have to give yourself another, like I say, we're at about 10 days now. Give yourself another 5 days to possibly get sick yourself, or you're still contagious and giving it to other people, although you're fine. So that's, with a lot of research, a lot of looking at other countries, what was going on way before it got here. That's how we kind of got to those numbers.
Okay. Yeah, just because again,
you just thought even after 14 days.
Yeah,
I don't know
like,
about you.
I don't know about that. I was like, oh, we about to be in some trouble. It's gonna be a long, quarantine.
And the crazy thing, even when my kid is in high school and the soccer team played another team, the school put them on 14 days, but it goes this 14 days. I think they're trying to overly be careful, but the 10 days is fine. And it's dead, it's gone. It's running in your body by 10 days,
Okay.
You brought up that point that, and I think, and I bring this up to put context on, how the vaccine becoming available and, disseminated to folks, how that will impact our society. You said that a person can be essentially have no symptoms and still be passing it. So that was going to be one of my questions. And I think a question that a lot of people have, if you're a perfectly healthy person, and, good immune system, strong, no conditions, how does the vaccine play a role? Like if that's person's me and I say, actually, I'm good. Why do I need to get the vaccine?
Well, us in the Black community, we're very communal. We want to protect our grandparents. We want to protect our aunts. We want to protect each other. You're fine, but you could have had it or have it possibly now. You're fine, and you're giving it to somebody else who's
not fine.
That's not fine. And as you may know about diabetes, high blood pressure, you don't feel that your blood pressure is high. So somebody could be walking down in your community or down the street or in your church or wherever, and they may not be even addressing their high blood pressure, and then you sit by them, then you've get it. So it's a protective value first. And then a lot of us, and we're finding as most seniors now, we're up to about 80% of seniors in this country that have got the vaccine. So the death rates have gone down because those were many of the people that were dying were seniors. So we're seeing people get it that are like 20s, 30s, and 40s that for the most part, they do okay. They may not have symptoms. They may have symptoms and get sick. There are some people that are younger that have conditions that they didn't even know, and we're seeing, unfortunately, some of the younger population being hospitalized. You go into the hospital now in this kind of mini surge that we're going through, and a lot of the people that are getting hospitalized, and unfortunately, even some of those that are dying are younger because they had a condition that they thought they didn't have, but you just don't know what's happening inside of your body.
And that what that brings to mind, you guys, is how when we're talking about people being younger, still being susceptible to it because they didn't know that they had these conditions, it makes me think of folks who don't have access to care and who don't get regular care and have, are living in food deserts, don't have access to proper nutrition and things of that nature. And I feel like that definitely has to play a part in it too, right? And when we talk about that disparity.
Right, for sure.
Us, right? So
for sure. Access, resources, where you live, is there a hospital nearby? Are there good doctors, or are there any doctors? It can be A to Z. Especially people of color. And then you get in the hospital and unfortunately we see, biases in how Black people are treated within hospital settings. There's lots of research that new medical school students coming out of medical school think that for whatever reason that Black people can take pain a lot more than white people. Where does that come from?
Well, and you know what?
Where does that come from? Oh my God.
In a paper that I was reading, it was on the book that you brought up, Devin, last week when we were recording Medical Apartheid, and talking about I wish I could recall his name, but he's referred to as the doctor of, or the godfather of gynecology, and how he was like experimenting on slave women, he and his other colleagues, you know what I mean, with no anesthesia, no nothing. And unfortunately, I think it really like goes back that deep, that they really
it does
see, don't see the humanity in us, that
for sure.
that insidious, white supremacy doesn't allow them to see that sometimes.
For sure.
And so unfortunate, so.
I'm gonna, like I said, we were preparing for another call that I was gonna be doing, and they wanted to talk about the historical facts. So they want to bring up Tuskegee and syphilis. And of course that's on top of everybody's mind. But in my mind, when they said the historical, I was like, well, are we going back to slavery? Are we going back? How far are we going back? Where slaves didn't get health care, you know? And then are we going to Jim Crow when we went to segregated hospitals? All of this, there's research now that we probably passed down a lot of this trauma, a lot of this pain, and then you're right. To me, Tuskegee is just the frosting on the cake, and
so much more.
Oh yeah.
Right. That's just my point. And I think Tuskegee was the point where the country said, oh my God, we're guilty. No, but this has been going on hundreds of years.
Yeah.
At that point, and we do address this in our toolkits, that was the time, the country said, okay, let's put protocols in place. That was totally unethical. It came to one of those kind of points, probably like a point we came to last night with the Chauvin verdict, to a point in time. So Tuskegee, although many things happened prior to that, as far as health disparities and just downright unethical treatment of human beings that happen to be descendants of slaves from Africa, or descendants of Africans, I should say, we finally said, okay, we're putting protocols in place. You can't just test on people. And those were all good things that came out of Tuskegee that helped the entire population, not just people. We started to make all kinds of protocols and put protocols in place. So that some people think, oh, they're just putting us, giving us the vaccine and trying to do experimentation. You can't do that anymore. And it's because of what happened in Tuskegee. So that was a good thing that came out of it. But yes, our issues go way farther back as far as health disparities in our community.
Yeah, definitely. And speaking of like protocol and ethics, what are some of the protocols and ethics that have been in place in terms of vaccine creation and distribution? Like, how has that played a role in the vaccines?
Well, first of all, people were recruited or asked to be a part of the studies that took place for Pfizer, Moderna, and Johnson & Johnson. It was requested that none of these studies could continue, because now we have a problem getting African Americans and Latinos and Asians into these studies. So, because we want to know how these viruses are in other people's bodies and how the vaccines work. So pretty well in getting diverse groups of people recruited. Okay, of course, you don't even test on humans unless you're at phase 3. There's phases that the clinical trials go through. People don't know that we were doing research on mRNA, which is the Moderna and Pfizer vaccine, years before now, years. It wasn't, warp speed. I don't know whose communication person said to do that. Complete mistake. We had SARS-1 was back in 2002. It didn't have a deadly effect, but we had research that came out of that. And then, like I said, we had research that also came out of later with Moderna and mRNA, which is those two are based on. And we've been working on those things for years. And they were not on people. When it got to the point that we saw, the death rate that we saw, it was time to kind of, I will say the last Trump administration put billions of dollars in so that we could work side by side and get this done, instead of the slow kind of, treading water.
Yeah.
And what we were doing, it wasn't an emergency. So put the money there, it happened. And all of the protocols that were there in, from Tuskegee and from those times and all the ethics and protocols that were in place, we were able to come up with these vaccines at a reasonable rate. I mean, the last vaccine took 4 years. Like I explained to my 17-year-old, oh my God, that was too fast. Well, technology has greatly improved in the last, and technology is not just iPhones. It's, what we do in labs and scientists do as well. So I hope that answered the question.
Oh yeah, it definitely did. Thank you. And just another question now that you've been talking. So for those who are weary of the vaccine, but they've had COVID and they came on the other side okay, and there's been like talks about COVID-19 antibodies. Like, how does that play into people's thoughts on getting the vaccine? And what would you tell people who are kind of referring to the antibodies versus actually getting the vaccine?
Yeah. So if you've had COVID and hopefully fared reasonably well, you probably had antibodies in your system, and you have them. The research is telling us now that you have a protective value of up to 6 months. And we ask that people still get vaccinated probably after that point, because there are variants and you can get the darn thing twice. And unfortunately, there are stories of people getting it the second time. And a cousin of mine got it the second time and passed away the second time. How it happened, I have no idea. So you can get it twice. It can be more deadly. And there's variants. Like I say, right now, this virus is still among us, getting stronger, finding bodies that are not vaccinated, finding ways to replicate, mutate, and become better and stronger. So that's what I would say. I say, yes, you still have to get it. You probably have some, like I said, some protective value for about 6 months. And then at that point, I would definitely consider and get my information and consider getting vaccinated, because you can get it twice and it could come back worse and stronger. And we don't know a lot about what this thing is doing in people's bodies. You hear stories that go from A to Z. And I mean, really, A, nothing, I'm good, to unfortunately taking your life. So we don't know, and many people, we haven't talked about long haulers, people that have got the virus and still have some like lingering headaches, lingering can't taste things, lingering smell issues. And so we don't know how long and this is going to take, and keep on going with those kind of things. So you don't want to get it again. This line. So.
Yeah, definitely. And I think I just have one more question. So for me, ever since quarantine started during the pandemic, there's been a lot of changes in what normal is. What do you feel like whenever we've gotten a hold of COVID-19 and are on the bright side of the pandemic, what is it going to look like in terms of normalcy?
Probably all of us will be affected in some way, shape, or form for the rest of our lives. My kids, you guys, all of us that have experienced this in some way, shape, or form. I wasn't a great hand washer. I'll be a great hand washer after this. I'll still kind of wipe down things that come into my house that other people touch, but I'll probably never get on a plane without a mask on again. So you're right. There's going to be some behavior change, and I would suggest people get on planes with a mask from now on. What we have noticed, through this pandemic is that like hardly anybody got flu. No one person died of flu. We usually have about 14,000 people a year that die of flu. Nobody got any of those things. So I think our new normal will be hopefully, with climate change and a lot of different things that we think have lent itself to making pandemics. I hope that we are just more equipped and ready to listen and listen to science, not politicians, when it comes to, if something like this does happen again, get your information from reputable and evidence-based sources. So a new normal is sure, we'll still go to beach or go travel, but like I said, you might wear a mask when you travel. Well, I will. I will continue to wash my hands. I think there'll be concerts and stuff, but don't be surprised if people are wearing masks and things in very crowded venues and things that. So I just think those are kind of things that will stick with us. When you look at China and who's been through a lot of these different diseases and the impact it's had on them, they didn't have a big mask problem because they got into masks with SARS-1.
Yeah.
Yeah.
Yeah. So, we would look at them crazy when they were in the airport, and stuff. It was incorporated into their behaviors. And so I foresee some of that for sure happening with us, just we'll be living differently, but it will still have fun and we'll still be meeting and getting with people.
Devin and I were laughing, Dr. Fuller, last week because we were laughing about how it's just so funny how we didn't realize there's some people that really was not washing their hands.
I know. With all the tissue and hand sanitizer went away, I was like, what about the soap?
What about the hand?
I know. Right. And I probably shouldn't say I wasn't listen, I washed my hands, but you're right. There is people that never wash their hands, never, things like that. So I think we'll be more cognizant of passing on disease, which we should be, right?
Yeah. No, definitely. And I definitely see myself wearing a mask when there's a lot of people and letting people know.
I do.
6 feet front, back, left, and right. Don't get near me unless you're trying to pay for my stuff. But then at that point, go ahead. You can stay right here. But other than that, nah, definitely need that 6 feet distance.
I know. I think that's going to be with us in our minds for a very long time. And, I don't even know how this vaccine, accountability, there's 40 universities now that have said you can't come back to school unless you get vaccinated. And I think we'll see more and more of that. Like, I think we'll go to parks and baseball field and football where they'll have the section where the vaccinated people are, I fully think that possibly could happen. Well, we're already seeing it happen in universities and places like that. So, so I think that's going to be our normal, normal. And that's still better than me, sitting in my kitchen table for working every day. I'll get vaccinated so I can go back downtown and go to my office.
Oh yeah, definitely. And so I think that was everything that I have. Did you have anything else, Danny?
No, I'm so glad that we got a chance to talk. We hit all our points and got
some good
information. And I think it's important for people to hear from folks who have all the knowledge and have done the reading and have their ear to the ground and have the experience and in that world and someone of course is as joyful to talk to as
you're sweet. Thank you.
Help. So it's been a great conversation. I'm so grateful that you came on with us.
Oh, no problem. Let me just push our toolkit again. I think it's easy to read. Just go to lung.org and put in Better for It. We partnered with the Center for Health and Equity for Black Americans, and it just came out with a wonderful product. And there's downloadables. You take it to church. It's wonderful. And then we also have one that's geared to Native Americans, Latino one in Spanish, and a general community one. But I just love our ones that is geared to that. And I think that a lot of the questions are there. We're not here necessarily to convince you of something, but I just want to give you the knowledge and then you can make your own decision, So if anybody wants to get in touch with me, Felicia.fuller@lung.org. Very simple to get in touch with me.
Love it.
Yeah, definitely. And we appreciate you, Dr. Fuller, for taking the time to be with us. We'll make sure that we get the website and the information up just so as many people as we can get, they can get access to it. And we really appreciate the knowledge and the experience that you have dealing with this. And thank you for sharing that.
Thank you.
All right, we'll be seeing you. Have a good rest of your day.
Thank you. You too.
Thanks again.
Thanks, guys.
Bye.
Bye-bye.